Artificial Intelligence Dr. www.abcpharma.net/English. User question. After implanting a ventricular leadless pacemaker, the Aveir VR, in a patient with second-degree AV block, there is no intrinsic atrial activity, as indicated by the absence of P waves on the ECG. What is the short-term and long-term prognosis for this patient? Cohere. The short-term and long-term prognosis for a patient with second-degree AV block who has undergone implantation of a ventricular leadless pacemaker, Aveir VR, and exhibits no intrinsic atrial activity, as indicated by the absence of P waves on the ECG, can be summarized as follows. Short-term prognosis. 1. Symptom relief. In the short term, the patient can expect relief from symptoms associated with second-degree AV block, such as dizziness, fatigue, or syncope, fainting spells. The pacemaker will provide ventricular pacing support, ensuring a more regular and adequate heart rate. 2. Device functionality. The Aveir VR leadless pacemaker is designed to provide reliable ventricular pacing. In the short term, the device is expected to function effectively, maintaining proper heart rate control and improving the patient's overall cardiac function. 3. Recovery and follow-up. The patient will undergo a recovery period, typically involving a short hospital stay and subsequent follow-up appointments. During this time, the healthcare team will monitor the patient's heart rate, rhythm, and overall recovery. They will also adjust the pacemaker's settings as needed to optimize its performance. Long-term prognosis. 1. Longevity and battery life. The long-term prognosis depends on the longevity of the Aveir VR leadless pacemaker, which is primarily determined by its battery life. The battery is designed to last several years, and the specific longevity depends on factors such as pacing rate and device usage. Regular follow-up appointments are necessary to monitor battery status and make any necessary adjustments. 2. Atrial activity. The absence of intrinsic atrial activity, as indicated by the absence of P waves on the ECG, suggests that the atria are not contracting on their own. In the long term, this may lead to a reliance on ventricular pacing for maintaining an adequate heart rate. Regular follow-up care will help monitor the patient's overall cardiac health and address any potential issues. 3. Potential complications. As with any implanted device, there is a small risk of long-term complications, such as device malfunction, dislodgement, or infection. Regular follow-up care helps identify and address these issues promptly. 4. Cardiovascular health. The long-term prognosis also depends on the overall health of the patient's cardiovascular system. It's important to manage any underlying cardiovascular risk factors, such as hypertension, diabetes, or coronary artery disease, through lifestyle modifications and medical management. 5. Quality of life. With proper pacing support and symptom relief, the patient can generally expect an improved quality of life, allowing them to engage in activities and maintain a more active lifestyle. It's important to note that the prognosis can vary depending on individual patient factors, the presence of other medical conditions, and adherence to recommended follow-up care. Regular monitoring and adjustments by a qualified healthcare team are crucial for optimizing long-term outcomes. GPT-4. After implanting a ventricular leadless pacemaker like the Aveir VR in a patient with second-degree AV block, and observing no intrinsic atrial activity, as indicated by the absence of P waves on the ECG, several considerations come into play regarding the short-term and long-term prognosis. Here's an analysis of both. Short-term prognosis. 1. Immediate heart rhythm stabilization. The immediate benefit of the leadless pacemaker is the stabilization of the ventricular rate, ensuring the heart can maintain adequate cardiac output. 1. This should alleviate symptoms associated with bradycardia such as dizziness, fatigue, or syncope. 2. Adjustment and optimization. The initial period will involve adjusting the pacemaker settings to optimize heart function, particularly focusing on ensuring that the ventricles are paced effectively to compensate for the lack of atrial activity. 3. Monitoring for complications. Short-term risks post-implantation include potential complications like infection, hematoma at the catheter insertion site, or issues related to the device positioning. 3. Close monitoring is required to manage these potential issues. Long-term prognosis. 1. Chronic heart function management. In the long term, the absence of P waves indicating no effective atrial contraction will mean the heart relies entirely on the pacemaker for maintaining ventricular rhythm. 1. This situation can lead to challenges in ensuring efficient heart pumping over time, especially if there is underlying heart muscle weakness or other cardiac conditions. 2. Risk of heart failure. Continuous reliance on ventricular pacing can sometimes lead to pacing-induced cardiomyopathy, particularly if the pacing is not synchronized with any remaining atrial activity, which, in this case, appears absent. 2. This can affect the heart's efficiency and potentially lead to heart failure over time. 3. Lifestyle and activity adjustments. Patients will need to adapt their lifestyle to the realities of living with a pacemaker. 3. Regular follow-ups will be necessary to adjust the device as needed and to monitor overall heart health. 4. Regular device checks. Leadless pacemakers like the Aveir VR have a battery life expectancy, and planning for device replacement or management when the battery depletes is a critical aspect of long-term care. 5. Managing other cardiac risks. It's also important to manage any other cardiac risk factors such as hypertension, diabetes, or high cholesterol to prevent further deterioration of cardiac health. Conclusion. The prognosis for a patient with a ventricular leadless pacemaker in the setting of second-degree AV block and no intrinsic atrial activity depends significantly on the overall management of the patient's cardiac condition. Short-term, the focus is on stabilization and optimal adjustment of the device, while long-term considerations include managing the risks of heart failure and ensuring that the pacing remains effective as the patient's condition evolves. Regular cardiac evaluations and adjustments to the pacemaker settings are essential to maintain the best possible quality of life and heart function.